It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Thanks again to Rachel Byrne for stopping by for the second week in a row. Next guest is Dr. Richard Manos, an orthopedic spinal surgeon from Skagit Regional Clinics, Riverbend. Spinal Global Alignment is our topic today. What's that?
Yeah, it's all about the alignment of the spine and really posture and body mechanics. And as a spine surgeon, that is Dr. Manos' focus is even before and after surgery, really working on your posture alignment, which is important.
All right, Dr. Manos and Shannon O'Kelly.
Dr. Manos, thank you so much for joining us. How are you doing today?
I'm doing great, thanks.
Well, I'm glad you're here. We're going to talk about spine surgery. You're an orthopedic surgeon. Do you have a fellowship in spine care?
I do, yep. I completed a spine fellowship at SUNY Upstate in New York a long time ago.
A long time ago, so you've got a lot of experience. Tell our listeners about your practice, but tell us a day in the life of Dr. Richard Manos.
Sure. Came from Boise, Idaho, out to Skagit Regional Health recently. I practice all spine, basically from the cervical spine, thoracic and lumbar spine. I see patients Tuesdays, Wednesdays, and Fridays, and operate on Mondays.
Tell us, did you get interested? I mean, why spine? I mean,
Sure.
As an orthopedic surgeon, why spine care? You know, we all know, as a physical therapist, it's certainly a complicated area.
Was in the Navy in San Diego, did my orthopedic surgery residency, and right from day one, I showed up there and I said, okay, what interests me? Spine, right from day one. My whole residency was devoted mostly to spine, and it was a natural progression to go into spine surgery.
Well, first of all, I mean, thank you for your service. I got to give a shout out for your service and being a veteran.
Appreciate that.
And thanks for that. But more importantly, thanks for taking care of spine patients because, again, it's complicated. Let's talk about the spine and why it's so complicated. Maybe a little anatomy 101, maybe some physiology. Let's talk about muscles, tendons, ligaments, nerves, et cetera, as much as we can on the radio.
Absolutely.
Anatomy 101, here you go.
Okay, here we go. So cervical, thoracic, lumbar spine. All those now bones then are connected with muscles, tendons, ligaments, and then most importantly, they're connected to your arms, your hips, and your legs, right? So the spine is the basic building block. Everything else functions around the spine. And so, you know, the nerves that go to your arms, the nerves that go to your legs, all connected to the spine. And so it's very important when we talk about the spine that we include the hips. We include the knees, we include the legs. And that's why orthopedics is a good marriage with spine because everything is connected. But again, all the impulses from your brain go down that spinal column to your arms and your legs. And that's why, again, the spine is extremely important.
It is so complicated. We talk about the kinetic chain, and you're talking about that right now, that everything kind of goes from the foundation up through the top. But more importantly, your spine is your core, and it's like the central, it's the grand central station of the body. Everything's got to come through the spine to get your arm, to get your legs. What are you going to do as a physician? Tell our listeners, you know, someone comes into your office, they have a complaint. What pathway are you going to take that patient on?
Sure. The big thing is really looking at the person as a patient, and you're trying to figure out, okay, why are they here? You know, what is going on? Yes, they may have back pain, neck pain, but again, as we've already said, everything is connected. Did they have their hips replaced? Did their knees have been replaced? What is their gait? What is their stance? What do they do for a living? And I try to marry all that up to get a better picture. Obviously, it's easy to say you have this MRI abnormality, but we don't operate on MRIs or CT scans or X-rays. We operate on patients. And so I try to get a really good picture of what that patient is going through in their day-to-day life. What is their overall function? What got them to this point that they now are in a spine surgeon's office? And so really that's the crux of it. And then to figure out, okay, you know, is there a gait abnormality? Is there a core problem? As we already talked about, the kinematics of walking, station, stance, sitting. What do they do for a living? So that's really the big part of what I look at when I first see that patient walk through the door.
So the point you're trying to make, and the point you are making, which is very important, is really your job at the initial visit is you're going to do a significant history physical. I mean, a lot of the information you're going to get comes from the subjective information the patient's describing to you.
Absolutely. I mean, that is the 90% of the battle, and I always tell residents and fellows, 90% of the battle is in the history and physical examination. Very little is in the imaging. It's all in that history and physical, and you're trying to get a good picture of what that patient is going through. Very few people need spine surgery. What they need is a quarterback to say, okay, here is your problem. here's what we can do for you, and go along those pathways that can put people in the right direction.
Dr. Richard Manos and Shannon O'Kelly continue their topic on Spinal Global Alignment next on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our topic today with Spine Global Alignment, Dr. Richard Manos and Shannon O'Kelly.
Dr. Richard Manos is joining us talking about spine care, orthopedic surgeon with a fellowship in spine surgery. And man, I really like the fact that we talked earlier, and you're really talking about talking to the patient. With the spine patients, it's so important that we have an idea what they're going through, what their history is, what they're telling us, and you're diving into that. But once you get through that, what about global alignment? You talked about global alignment a little bit off air, and I like that idea, and I like that terminology. Tell our listeners what global alignment is.
What separates us from any other animal species or anything else on this planet is our ability to walk upright. Our head's over our pelvis. That is everything. So when you have hip pain, knee pain, or you've had a hip replacement, a knee replacement, your overall ability to keep your head over your pelvis may change. And so what's really important in spine surgery and spinal care is that ability to put somebody's head over your pelvis. And so that's really my big push in spine care, and especially at Skagit Valley, is that I want people to know how to keep their heads over their pelvis. And a big part of that is physical therapy, obviously, core stabilization. And my big push is always with trekking poles, gait efficiency. How do you make somebody's gait more efficient? How do you keep them from looking down at the ground, keeping their forward gaze so that they walk better, have more efficiency, strengthen their core, etc.?
Well, I'm super excited right now. I mean, I've got to tell you, I think we might be related somehow, because as a physical therapist, I mean, that's our MO. That's where we start. Right? It's the body mechanics, it's the posture, it's the functional movement, and assessing the patient. So we're kind of in the same piece of the pie here. I love this. Now, if you do need to do surgery, I mean, do you not? I mean, you're probably one of these surgeons that you really have to counsel the patient, because spine patients, a lot of times, they're in a lot of pain. They want surgery. You're trying to be conservative. And if you do surgery, their expectations have got to be set for these patients. I mean, how do you set the expectations for results?
Sure. So basically, with anything, literature is wrought with high success rates, low success rates. Spine surgery has a very bad rap in a lot of places, and for a good reason, right? Poor spine surgery leads to long-term sequelae in patients. And so what I try to get patients to realize with spine surgery is that I am going to keep your head over your pelvis. We are going to rehab you before surgery to get you prepared for surgery, and then we're going to rehab you after. You have to buy off on that program in my practice, and the reason for that is plain and simply success. If you put those parameters together, before and after, keeping the core strong, keeping your gait, keeping your head over your pelvis, your success in surgery is going to be high. And that's really what my premise is. And then also to do it with the least destructive means possible, right? Minimally invasive, if you can. But again, attacking the problem, not just looking at that MRI and saying, oh, all those levels are bad, we have to deal with all of them. No, you try to figure out the pain generator and then keep it to that.
Dr. Manos, thank you so much for your time. Great information. I mean, I'm so excited to talk to you and get to know you, because, again, we're in the same kind of family here. It's
Sure.
Function, it's movement, it's education. Thank you for your time again.
You're welcome.
All right, thanks again to Dr. Richard Manos, orthopedic spinal surgeon from Skagit Regional Clinics, Riverbend. And if you'd like more information, seniorclinics.org, srclinics.org. And the spine, there's a lot of stuff can go wrong.
Oh, it's a complicated part of your body, Tom. And if you've never experienced back pain, then you're lucky. But most people will, and it's good that Dr. Manos is out there looking at global alignment and posture.
And a lot of advancements being made in that field as well. Next up, Debbie Miller, a midwife, joining us on Como.